I give you Senator Elizabeth Warren.
Thank you. Thank you. Thank you. Oh, thank you. You guys are it. That's it. Thank you. Thank you. Sit in. Sit. Thank you. Thank you. Thank you very much. And thank you for the very warm introduction, Phil. You know, I was someone, this is the first office I ever ran for, was the United States Senate. And one of the people who was there early and said, if you will get in this, I will be with you all the way, and has followed through on that promise, has been Phil Villers. And I just want to say thank you, Phil. Thank you. He's the best. So I just want to talk to you a little bit about health care. And I want to tell it a little bit from a personal perspective. I grew up out in Oklahoma. I grew up in a little house. Yay, we got somebody out there, right? I grew up in a little house. It was on a gravel road that was on the last street in town. And behind us was nothing but open prairie for miles and miles. My three older brothers slept in what had become a bedroom. It was actually a converted garage. My daddy had a lot of different jobs when I was growing up. He was a traveling salesman. He fixed cars. When I was about 3 or 4, he got a steady job at Montgomery Ward selling carpeting. And for the next few years, my 3 older brothers all headed off to the military. My daddy worked steadily. My mom and dad decided to move to Oklahoma City, the big city, a nicer house, an Oldsmobile station wagon with air conditioning. I felt pretty safe as a kid. And then it happened. My daddy had a heart attack. And I remember visiting him in the hospital. I remember how gray he looked. I remember the way, that hushed tone that people use when they talk about someone who's sick. I remember the casseroles that people brought to the house. That was pretty scary stuff for a 12-year-old kid. After he got home from the hospital, he was home for a long time. In fact, long enough that our family lost that station wagon, long enough that we nearly lost our home. I remember how my mother cried every single night. And eventually we made it. My mom went to work at Sears. I babysat, I waitressed. My daddy eventually made it back to work. We paid off medical bills for years. We're a family, we weren't rich, we weren't poor. We had been moving up just a little bit in the world. A nicer house in the city, a station wagon with air conditioning, maybe a little savings, but one medical incident, one terrifying moment and a trip to the hospital, and our lives had just been turned upside down. My daddy ended up as a maintenance man. My mom worked minimum wage. Eventually, they gave up the house, they moved to an apartment, and they never rebuilt. No nicer home, no station wagon with air conditioning, no savings, no retirement. And here's the thing, we weren't unusual. Shoot, compared with families who are dealing with a child with complex medical needs, compared with families that are dealing with chronic illness, families that are dealing with the cost of drugs to treat MS or cancer, we were lucky. Starting back in the 1980s, when I was a law professor in Texas and then in Pennsylvania and then eventually at Harvard, I did a lot of research on why working families go broke. My co-authors and I uncovered one of the key reasons: medical problems. In fact, we were the team that first identified medical bankruptcies and the impact that it was having on hundreds of thousands of families across this country who were filing for bankruptcy in the aftermath of a serious illness or accident. You know, and the way I see this, it is tough to be sick. It is tough and it is scary. And despite how far we have come in recent years, the way that people pay for health care in America still puts all but the richest among us at risk. I think that is wrong, And that's why I am in this healthcare fight all the way. That's why I'm here. For too long, giant insurance companies have pretty much run the show when it comes to healthcare in America. They have squeezed hardworking people to improve their own profits. And I say it is time to flip the script. Healthcare in America should be about the well-being of families, not the profits of insurance companies and their executives. That's where I am on this. So, with that as the goal, I want to talk today about how we get there. Now, I want to be absolutely clear in the presentation that I make today. We will defend Medicaid and the Affordable Care Act with everything we have. We will defend it all the way. But I'm here because I believe we need to do more than play defense. Millions of families are counting on us, and I believe it is time for us to go on offense, and that's why I wanted to come. Now, the Affordable Care Act made massive strides in expanding access to health insurance. Even today, more than 28 million Americans, however, are uninsured. I endorsed Bernie Sanders' Medicare for All bill because it lays out a way to give every single person in this country a guarantee of high-quality care. Everybody gets covered. Nobody goes broke because of a medical bill. No more fighting with insurance companies. This is a goal worth fighting for, and I am in this fight all the way. But there are other approaches as well. We could give everyone the option to buy public coverage on the ACA exchanges, like Senator Whitehouse and others have proposed. We could let every person in the country choose Medicare, like Senators Bennett and Kaine have suggested. We could let families buy into Medicaid, which is the plan that Senator Schatz has put forward. We could let employers buy Medicare coverage for their employees. I am glad to see us put a lot of different options on the table. But each one of these proposals is about using public insurance to supplement private insurance, either temporarily or permanently. And so, of course, private insurance companies hate every one of them. But consider what's happening to the 216 million Americans who rely on private health insurance. Just think about what their lives have been like. Between 2005 and 2015, out-of-pocket costs for workers with employer coverage rose twice as fast as wages. Over the past decade, the average deductible on an employer plan has risen by 255%. And today, 1 out of every 5 Americans says they have not filled a prescription for a medication that they need because it costs too much. When you take all of these things together, it is no wonder that 3 out of every 10 Americans with health insurance say that they are having a hard time paying their medical bills. Shoot, hard time? That is an understatement. Medical bills today can stretch a family's budget to the breaking point. A family's security, built up over years, can be swept away by one serious medical problem, just like what happened to my little family in Oklahoma many years ago. So the question we have to ask is, why can't middle-class families get good coverage at an affordable price? And the answer is straightforward. It's one word: profits. A private insurance company maximizes its profits by bringing in the most money possible from its customers and paying out the least money possible for its health care. And that's exactly what insurance companies do under the current rules. Private insurance companies are failing the American people. We all know it. And whatever public alternatives you support, there is no reason on our earth for us to continue to allow the health care of the American people to be held hostage by an industry that both attacks any new health care proposals and at the same time refuses to do anything to fix it. But here's the good news. The government sets the rules and the government can change the rules. Thanks to President Obama's leadership, the Affordable Care Act made enormous strides in leveling the playing field for families. Protections like a ban on annual and lifetime limits, guaranteed coverage for mental health and for addiction services, ending discrimination that allowed insurers to charge women more for their insurance than they charged men. That's real progress, and we should celebrate it. But we can't stop there. We need to build on that progress and to do more to hold America's insurance companies accountable. I believe that America's government should work for the middle class and not for insurance companies and their executives. And that means so long as private insurance exists, we should require these companies to provide coverage that is at least as good and priced at least as reasonably as the coverage offered by our public health care programs. And that's what I want to focus on today. So I have 3 straightforward proposals that would significantly improve access to health care for the 216 million Americans who are currently in private health insurance programs. First, don't let private insurers cheat people. There we go. Second, require private insurers to be just as affordable as public insurers like Medicare and Medicaid. Yeah. And third, when the insurance companies howl that they can't possibly be expected to do number 1 and number 2, call their bluff. So let me do these in a row. First, it is time to end the tricks that private insurance companies use to try to shift the cost from themselves to their customers. You know, there are a lot of these, and I'll talk about just a few, like drawing the boundaries of their network so narrowly that a lot of people can't see a doctor. I've got somebody already applauding on this, right? Dropping drugs from a plan in the middle of the year so someone doesn't, yep. We're seeing who's been hit by these different ones, right? Ambushing people who rely on outdated provider directories. Junking plans and forcing people to go through the painful process of picking a new one year after year after year. One that's particularly hard on people who are in the middle of a course of treatment. You know, ask anyone about whether or not insurance is working for them. Ask them and then stand back as the horror stories come pouring out. The mom with a sick kid, and this kid needs to see an ear, nose, and throat specialist, but she's told she's going to have to drive 5 hours to find a doctor who is in network. The patient with a rare disease who is terrified that she'll log onto the marketplace next year and find 0 plans that will permit her to continue to see her same doctor. Or the worker who is in constant pain but is too worried to go seek medical treatment because every time he has in the past, the insurance company has managed to hit him with a bill that's the same size as his mortgage payment. You know, these examples that we've documented aren't the exception. They're the rule, and they should be outlawed. And to catch evolving scams, we should set up a program to compile consumer complaints about insurers and to run down this kind of nonsense before it spreads from one insurance company to another. So, my first principle, stop the tricks. The second one is I believe we should hold private insurance companies to the same kind of coverage standards that Medicare and Medicaid already meet. I want to look at the difference between what Medicare and Medicaid do and private insurance companies. Medicare premiums for most beneficiaries cannot grow faster than Social Security checks. But premiums for plans on the Affordable Care Exchanges are subject to little or no oversight, and they frequently grow by double digits. Medicare covers 84% of every dollar of health care costs, while private exchange plans cover somewhere in the range of 60 to 70 cents on the dollar. Medicare Advantage and Contract Medicaid require insurance companies to prove that they have enough in-network doctors whom the patients can find, while exchange plans use a much weaker standard. The list goes on, and the differences may seem small to someone who's never encountered them, but they make a huge difference in the lives of millions of people around this country. And every one of those differences is based on policy decisions made right here in Washington. So I say, let's make different choices. Congress should require insurance companies to meet the same standards as Medicare and Medicaid on costs, on coverage, on doctor networks, and on profits, period. That's what I think they should do. Okay, stop the tricks, raise the coverage standards for insurance companies, pretty simple ideas, but I guarantee that the mention of them will trigger immediate outrage from the private health insurance industry. They will claim that these basic protections and standards will put them out of business. They'll stamp their feet, they'll threaten to walk away from healthcare exchanges, and my response, give me a break. You know, the 5 biggest publicly traded insurance companies in this country together cover 125 million people, and they are raking in cash. More than $17 billion in profits in the last year alone. So don't tell me that an industry that has $17 billion in profits to hand out to its investors and its executives in a single year cannot do right by the American people. Just don't tell me that. And as we wrestle with insurance companies to try to get them to treat their customers a little better, keep in mind on this that taxpayers are directly responsible for a huge portion of those giant profits. The top insurers in the United States pull in nearly 60% of their total revenue from Medicare and Medicaid. That is more than $200 billion in 2016 revenues coming directly from American taxpayers. And that's not all. Through the tax code, the federal government subsidizes the cost of insurance to the tune of $260 billion a year. And through the Affordable Care Act, over the next decade, taxpayers will contribute more than $500 billion to insurance companies. Taxpayers have helped make insurance companies wildly profitable, and taxpayers can demand fair treatment in return. So that gets me to my third proposal, and that is when the insurers complain that they just can't accept these reforms, let's call their bluff. If an insurer wants to bid on a Medicare Advantage contract or a state Medicaid contract, they should know that they could also be required to participate in that state's health insurance exchanges. Don't you think so? In other words, if they want to bid on the really juicy federal health care contracts, they should have to offer a basic private insurance plan for individuals as well, even if those exchange plans don't produce quite the same juicy profits for their investors. That's the basic idea here. And if some insurance companies really, truly are not willing to provide high-quality, affordable coverage in exchange for billions of dollars in federal subsidies and access to Medicare and Medicaid, if they really and truly want to pick up their toys and go home because $1 bazillion in profits is not enough, then I say good riddance. If the insurance company walks, then we should replace their policies with public alternatives that we already know will provide better, more affordable coverage at a lower cost to taxpayers. Look, this is not pie-in-the-sky stuff. Massachusetts has the highest rate of health insurance coverage in the nation. Woohoo! And we are the healthiest state in the nation. Double woohoo on that. But that didn't happen because we just woke up one morning and discovered that the insurance companies had started offering great coverage at an affordable price. No, we demanded that the insurance companies live up to their side of the bargain. Every insurer participating in our exchange is required to offer plans with a standard, easy-to-compare benefits with low upfront costs for families. Last year, we had the second lowest premiums in the ACA market of any state in the country. Massachusetts insurers pay 92% of the dollars they bring in out through premiums, of the dollars they bring in through premiums out to cover the health care costs of their customers, not to line their own pockets. So think about that. We've kept coverage higher for our families in Massachusetts, and we have kept premiums lower than in many parts of the country, and the profitability of the plans has not gone larger, it's gotten smaller. Massachusetts insurers are spending 92% of the money that they bring in on premiums to turn it around and spend it on health care. You know, the rules are tough in Massachusetts, but the insurance companies have shown up and they have done the hard work of covering families in a responsible way. We have more than double the number of insurers participating on our exchanges compared with the average across the country. And I believe what this shows is that insurance companies will show up to serve if we put good rules in place. Now, I don't kid myself. We still have plenty of work to do in Massachusetts, particularly when it comes to bringing down healthcare spending. But we are proud of the system that we have built. And I think what it shows is that you can put good policies in place and help improve both the health and the financial security of the people that you serve. You know, this fight to give access to healthcare has been a long fight. I don't have to tell the people in this room. Franklin Roosevelt, Lyndon Johnson, Ted Kennedy, Barack Obama. And with more attacks on Obamacare and on Medicaid and on Medicare, the fights to preserve what we have are tough and they're going to get tougher. But if this past year showed us anything, it's that we're ready to take on the tough fights. We are here to fight back. When the Republicans laid out their cruel plans to repeal the Affordable Care Act, the American people fought back. In Congress, the phones rang off the hook. Moms showed up in the Capitol with little ones in tow, little babies that had to use breathing tubes, babies that were born with holes in their heart. And those moms and their kids simply refused to go away. Activists rolled their wheelchairs right into those hearing rooms and into senators' offices. They put their bodies on the line to protect health care for themselves and for millions of people across this country. The Republicans did not succeed in repealing Obamacare. Nope. Democracy showed up to fight for health care in 2017, and democracy won. Now look, I get it. We're still under attack. But let me tell you something about these fights. I remember in the middle of these fights hearing people say, everyone's just going to get tired and go home. They're going to give up. And this is how I see it. You don't get tired when you're fighting for little kids who need breathing tubes. You don't run out of steam when you're fighting for moms, your brothers, your sisters, your neighbors. You get stronger and stronger and stronger until you win the fight. That's what we do. So, I see this as the time to play defense, but also the time to play offense. This is the time to move forward. This is the time when we put the issues on the table and we argue for them. It is time to demand a healthcare system that works for all of us. I believe America is ready for this fight, and there is no one I would rather to stand shoulder to shoulder with in a fight for the health care of America than the people in this room. So I want to say to all of you, thank you for all you have done, but now we just got to do more. We've got to do more because the people of America are counting on us. We've got to do more because it is the right thing to do. We have got to do more until we finally have a healthcare system in America that works for all of the American people. That's our job. So thank you all. Thank you. Thank you. Thank you. Thanks for all you do.